I'll be speaking on this. Like Caesar said, I think he has taken some words from my mouth. Now, why this is so important? Why this matter? Talking about beyond the risks, integrating a medical sociology perspective to human-animal bond. One is because zoonotic risk is not only biomedical. Like I've always said, in the past years, the veterinarian, the scientists, the biomedical people have been working, treating zoonotic disease from the biomedical and biological perspective. But this has gone beyond the biological perspective. So, because like I used to advocate, when we are talking about zoonotic disease, when you keep aside and make it a biological perspective, you'll be missing a lot of things. Because one, it is social, because human and animal, they live together, they work and care together. And also risks, most of these risks emerges from relationship, not just from pathogen. Even the pathogens have some relationship within the disease family, because to start with, one cannot get infected without having a contact with animals. So there must be a connection, there must be a relationship, there must be contact, and those contact has to be social or culturally and environmentally inclined. And that's why zoonotic disease is not just only biological. So, and from the diagram there, you can see the first diagram here, you can see the child with a goat, talked about contact, talked about relationship. Now you can see the second human here with also a goat going to the market to sell, contact and also relationship. Now, going down here, you can see the diagram I presented. You have the health, which has a human, you have the care, which has a goat, and under the cycle, there is a zoonotic risk that rolls around in between us. So yet, this relationship is largely invisible in zoonotic research and policy. And that's why One Health often integrate disciplines, but not just relationship. Now, how is zoonotic risk? How zoonotic risk is usually framed. And over the years, like I've said, we just have it as animals, which is the reservoirs, the vectors, and the threats. Then on the other hand, we have humans, which has to do with the risk bearer managers, behavior change target. Now, what is the assumption of all this? Is because if people know the risk, they will change the behavior. But over the years, this has not been done. So that's why, as a medical sociologist or as a medical anthropologist or social scientist, we are now advocating that in the place of zoonotic risk, there must be the knowing of the risks. And when there's a knowing of the risk, in return, there will be a behavioral change in that risk. And this has to do with relationship, this has to do with human, this has to do with the environment, this has to do with culture and behavioral pattern. Now, the blind spot in this practice, what is it? In outbreak preparedness and response, an intervention often prioritized, like I was discussing with Colin before this meeting started, that over the years, the scholars in the health and medical aspect and the vet, they've only prioritized pandemic or outbreak preparedness on surveillance, biosafety, and separation of humans and animals. But that is not the case. Now, when you look at this, like I said earlier on, this zoonotic or outbreak preparedness, it is socially inclined and environmentally incorporated. So when you do away with that, that means you've not solved the problem. But when you bring surveillance, you bring biosecurity, and you also bring about the social, cultural, and community engagement, then you'll be able to solve the problem up to 60 or 85%, reducing pandemic. Now, but we really ask, that is the question, what do animals mean to people? That's a big question that we have not asked ourselves. Now, what is lost when animals are removed or killed is a question that the biomedicals and the scientists have not really asked, but which is also sociological inclined. Moving forward, medical sociology, a different lens in zoonotic preparedness in relation to human-animal bond. Medical sociology, over the years, we've asked a lot of questions. Who is exposed and why? Because, and that's the question we've not asked ourselves. Who are the people exposed and why are they exposed? Also, what risks are avoidable and which are structural? Because most of these risks are, the risks are what socially produced. That's just the truth, because the risk is within the society. It is not within the, even if it's within the animals, that animals cannot, we cannot send the risks to himself. It has to send those risks to the individual because there is a contact. And those contacts is between human and animal within the ecosystem. So there's a shared transmission of this disease, which is also socially produced. And this exposure is structured and it is not choosing. And that's what I've just explained. And what are the key concepts? There's structural vulnerability. People are exposed not because they are careless, no, but because their livelihood, identities, and care obligation demands this. That is social and this culture. So, but when we fail to realize, put this into context, now we will not be able to identify to solve outbreak preparedness. But when we understand that people's livelihood depends on this, then in one way or the other, we'll be able to solve what pandemic preparedness. Now, for example, the Nigerian case, livestock and care. There's a lot of outbreaks in Nigeria, severally. We have Ebola, we have Lassa, and over the years, I've worked in the field, and even at times, you are even exposed. I think severally, I think last year I was exposed to respiratory tract infection while in the field. Now, it's not because I was careless, it's because these diseases are socially structured in the society, because I have contact with people within this ecosystem, which I don't know who is the carrier. So, and that's why in northern part of Nigeria, we have the livestock are economic assets of people. A lot of the northern people in Nigeria, that's their livelihood, the nomadic people. That's what they live on. So you won't, now, if you want to look at this, we now have to now say, okay, now this is a livelihood. So we must understand the socio-economic factors of disease causation in a society in order for us to solve outbreak in the social status. Now, animals are housed close to families. In Nigeria, in most parts of the country, people keep their animals, they share, there's a share, we call it multi-species, multi-species within the system, because they live where the animals stay. They share the same apartment, they share the same room. And in the process of this shared bondness, there might be transmissions across the ecosystem. So sick animals are cared for and not isolated. Animals that are sick, they don't throw them away, they care for them. So in the process of that, there is a shared transmission. So, but policy response often assume unsafe behavior. Sociological reality is avoiding contact becomes a problem. Now, the whole lot, but let me just move on. Why the human-animal bond is ignored is a very critical question. Now, there are three structural reasons. One, the biomedical dominance, like I said earlier on. Relationships are hard to identify. It is very, very paramount. You cannot quantify relationship. Is what you cannot do. Now, because in the biomedical dominance, we fail to quantify this relationship because that is not our interest. Now, when ignoring the relationship, quantifying the relationship within the ecosystem, you will not solve the pandemic preparedness or zoonotic risk. Now, two, behavioral change logic. We assume rational choice and ignored constraint. Policy discomfort. There's a lot of policy within the system that we have not been able to put in place to bring about this bond between human and animal, even if we know that the animals harbor a lot of their reservoirs of diseases. Now, for the fact that they are reservoir of diseases, there are ways we can create policies to checkmate and care for these animals, that the animals will be safe and the human will be safe and the ecosystem too will be safe. But ignoring complexity, weakness, effectiveness, that's the greatest challenges we have. Now, what happens when this bond is ignored? We have poor reporting system. Diseases are not reported. Why? Because if I know my animal, I'm a cattle rearer or seller, I know my animal is sick, I cannot go and report it, because if I know if I should report it, people will not buy it, there will be stigma. So this brings a lot of serious problem in. Now, delay in detection, also breakdown of trust. Then we also have failed intervention, because we ignore this bond. But when these bonds are not ignored, now there is this trust between the people to know that, okay, now their animals is sick. Okay, let me report it to the vet or to the appropriate quarter. They will come and treat the animals. They will not kill the animal. But when this bond is ignored, there's no way I will be able to come and report, because one, I don't even know the appropriate channel to report such cases. So there is a whole lot to do. Now, policies, the irony is that policies are designed to reduce risks. Policy designed to reduce risk can increase it. That is the irony of all of this. Now, what a socially grounded One Earth looks like. A medical sociology contribution is treat human-animal relationship as data, not as noise. That's one thing we need to put in place. We must treat this as data, not just because we want to report disease. No, when we treat it as data, in the sense that now this relationship between human and animal is very, very important to us, because when we have those data of the relationship, that will be able to help us the number of risks, how to mitigate risks when the risks when there's an outbreak. Now, we should also use the ethnographic before intervention design. That's what the biomedical don't do. What is ethnography? You go into the community, you live with them, you understudy them, you eat their food, you stay there for 6 months or 1 year thereabout. So that you'll be able to internalize with the people, you know their culture, you know what they do. And by so doing, the people now trust you, because you've lived with them and they know you. Now, by so doing, when you are doing that, you know what the challenge is. Then you'll be able to give intervention, not just giving intervention and in an abstract environment without knowing what is on ground. Now, recognize loss as economic, emotional, moral, practical shift. Now we must do participatory surveillance. What is participatory surveillance? Just like you having ethnography, you go in there, live with the people and do the surveillance. You live with them, you do what they are doing, you go to farm, you help them, you move with the household so that they will have that bond. Then there's transparency. Then community co-design. Community co-design in the sense that you work with the community leaders, you work with the community stakeholders. Let them have that trust in you because you are there. But when you are not there, you cannot give policy when you don't know what is on ground in the community. And you knowing what is on ground in the community warrants you having participatory surveillance and ethnography, because you are living with them, you know what is on ground, and you interact with the community and with the stakeholders within the community. Why this matters now? That's a big question. Because it matters because we want to raise rising zoonotic spillover, because there's a climate stress, then livelihood precarity. Now, as a result, as risk increases, dependency on animals also what increases. So One Earth cannot succeed without understanding care, attachment, and relationship. Now, what is the take-home message? The human and animal bond is central to zoonotic risks. If we don't understand the human-animal bond and relationship, there is no way we'll be able to understand the true nature of zoonotic risks, because the human-animal bond has to do with community, social, and cultural and environmental context. So when we know that, then we'll truly understand the true context of zoonotic risks. Also, ignoring it undermines research and policy. When we don't take into cognizance the relationship between human and animal bond, then we are missing out. We cannot give a good policy. Then medical sociology strengthens One Health by making relationship visible. Now, the final thought: if One Health is about integration, then relationship must count. That's the take home. Now, what is the question for us? Does focusing on human-animal bond weaken biosecurity? How can policymakers account for emotional bond in emergencies? How does this fit within existing One Health framework? We already have, a lot of countries has One Health framework. Now, what we are saying now about the One Health human-animal bond relationship, how does it fit into the existing One Health framework? Also, what is the single policy implication? Thank you for listening. So these are some of the pictures while in the field. Thank you.